To this, Deputy Minister in the Presidency, Thembi Siweya, is visiting the COVID-19 vaccination site, Aurum Research Trust, at the Tshepong Tertiary Hospital in Klerksdorp in the northwest. A total of 7,517 healthcare workers were vaccinated as of the 1st of March. They are part of more than 16,000 health professionals who are registered to receive the jab in the province. For more, let's cross live now to our colleague Senthleeng Lehihi. A very good day to you, Senthleeng. What can you tell us about where you are?
Good day to you and our viewers. We are here at the Klerksdorp Tshepong Hospital in Klerksdorp in Northwest. We are joined by the MEC of Health in the province, who's going to also be joined by the Deputy Minister in the Presidency as they conduct an oversight of vaccination sites as the vaccination of healthcare professionals is underway. As you understand, this is one of the facilities that have been earmarked to conduct vaccinations for healthcare professionals in the province. As you mentioned earlier, as of the 1st of March, at least 7,000 healthcare professionals had been vaccinated, but I've got a new update from the MEC explaining that the numbers have increased quite significantly there, and just almost 10,000 of healthcare workers have been vaccinated at this point. You understand that we saw earlier in February our first consignment of vaccinations arrive, and just last week our second consignment of vaccinations arrived with at least 7.6 thousand doses that have been available to the province. But to have a clearer understanding of where the province stands right now with vaccinations of healthcare professionals, I'm joined by MEC of Health in the province, Mr. Madoda Sampata. Can you tell us, MEC, you are here in Klerksdorp Tshepong. This is one of the facilities that has been earmarked for vaccinations. Are we happy with progress so far?
Thank you very much. As the province, we are happy with progress registered. So far, remember, we started with 2 facilities, Klerksdorp, Tshepong and JST. As we speak, 3 were added last week. If you check the numbers, 9,950 as of yesterday, close to 10,000. If you were to check whether it's a good number, it's a good number, of course. If you know, Klerksdorp was responsible for Dr. Kenneth Kaunda. The whole of Dr. Kenneth Kaunda has been done on vaccination, except a few 10%, including me, who received a notification that I must come on Thursday last week because I'm registered here. I did not come because I'm waiting for Dr. Ruth to get their vaccination. I can't be the first one, and healthcare workers are the last ones. The issue of the numbers to us, the 10,000, it's a correct number and it confirms a good performance. The minimum you don't have, it's either technical logistical glitches or it's individuals who would have received a notification to come but they decided not to come. It is not people who came here and then refused. That's why we're saying it's a success. As we speak now, with 5 sites, added 3 last week, next week, we're going to officially have a start in Dr. Ruth. Remember last week, Ngaka started, which means in a period of 2 weeks, we're going to be adding another close to 10,000 numbers to the whole. Remember the numbers of us provincially for healthcare workers, it's between 42 to 45,000. The reason being, we're not sure of the number of the traditional health practitioners. We get them as they register. But we have both community health workers and healthcare workers, private and public. That number for us means that 42 to 45,000, we can do it in a period of 2 months if we get vaccination properly. Now, the problem with the vaccine is that it comes in a break of weeks. It's 80,000 in 2 weeks. When it arrives, you get your share as a province. Then you vaccinate, then wait for the other one to come. But we hope the nation is going to then break up the issue of buying more for vaccination en masse, especially for phase 2 and phase 3. The debate by many people about private providers buying and medical aid schemes buying. It's not necessarily a debate where government has closed out. The only issue is that anyone who has money to buy, the number that the budget qualifies for, must then confirm to national, so that when national negotiates buying, it includes that additional number that that person has. Remember, national buys across the globe, nations buy countries. Distribution is both private and public.
Now, MEC, the province finds itself in a very precarious situation. We're currently leading national statistics in terms of fatalities as a result of COVID-19 complications. It brings a bit of, wonder and concern as to whether or not the province is doing enough to curb the scourge.
In terms of the COVID numbers on fatalities, the problem with fatalities is that you're talking of fatalities registered yesterday, but it is number of fatalities of people who have passed on in the period, but they were cleared on national verification yesterday. So it's not people that died yesterday. It's people that have been buried. They have been recorded provincially in each facility. But the problem is national has to clear data and confirm. Once confirmed, it adds. So it is not people that died yesterday. It's numbers that were confirmed yesterday.
But are we not at all concerned about the rate of these deaths?
The rate of deaths, especially after second waves, are of serious concern to us. But remember, government care, especially caring government, like an ANC government, one death, it's one many. So we never plan to allow a situation where one of our citizens, because of how we treat them, dies. We always maintain the fact that, if possible, we should do whatever we have to do to prevent losing lives, especially in a healthcare system. But remember, in a healthcare system, you can't 100% say you will never have, but you do your best, and your healthcare professionals do their utmost best. The numbers are high throughout the country. The numbers are high in the province. And one of the reasons why they are high, we keep explaining, people are presenting themselves very late during this second phase. It is very difficult to even do resuscitation because they arrive in facilities at a critical moment. Yet, had they appeared earlier, many things could have been done to ensure that at least losing their lives is prevented by government. So it's too many people that die. We can never be happy when our people die.
Thank you very much for your time, MEC Madora Sambata. But as mentioned, we're right here in the thick of things where vaccinations are expected to happen. And I'm going to steal a moment here to talk to you, Madam, about how do you feel about the possibility of you being vaccinated right now? She's a bit shy, but it's understandable. It's quite, a precarious thing.
Okay, ma'am, I was not expecting this, but at the moment, I am very happy because I've seen the progress in this, and many has vaccinated, so at least many people are coming at the moment, so I'm very happy.
And there you have it, word from healthcare workers here at the Klerksdorp Tshepong Hospital. Looking forward to vaccinations. For now, back to you in studio.
Thank you so much, Senthleeng, as always, for that thorough feedback for us. And that's it from the agenda for today. Thank you so much for watching. Till next time, bye-bye.